in charge of all the trainings and getting all of our affiliates acclimated to the process. So if you guys have any questions, please let me know. Feel free to chime in at any point. I am going to start the slideshow so that you guys can see all the charts that I have for you. So, switch to, turn this off, turn this on, right? And then play it. Perfect. Okay, guys, so we're going to go over the Affordable Care Act, and my goal today is to kind of demystify this for you. So first of all, what does the Affordable Care Act mean to you? It's going to offer your business a new niche, okay? It's going to give you the ability to expand your existing client base, bring in new clients, and also it's going to generate some new revenue for you guys. So get excited. I want to give you a brief history about why this is important and who we are. So the business of healthcare reform and why we're able to monetize healthcare reform is because as of right now, there are 54 million documented uninsured Americans, okay? 54 million that we know about. And out of those 54 million, 100% of them file taxes. That's where the Census Bureau gets that number, which is equivalent to a $200 billion pool. Yeah, with a B, billion, $200 billion. That's how big this pie is. People are starting to get it. You know, there's an opportunity to really make some money here, and this is the way that we will close the gap between tax professionals and the healthcare industry. So out of those 54 million, they all file taxes. So we're assuming there's another maybe tens of millions more living here in America that don't have insurance that need it. So this is a very conservative number. The Affordable Care Act, it makes healthcare affordable and available to everybody who applies through the marketplace and individual state exchanges. It's federally regulated, federally funded, but there's a handful of states like California and Chicago, well, Washington, D.C., which is not a state but a territory, that have their separate exchanges. We process all of them. Any state that you can get applications from, you can send to us. We can process them. Now, just so you guys have a clear understanding, and I'm sure most of you are familiar with this, but I need to hit the highlights. In applying through the marketplace, they're actually applying for a subsidy and getting access to a tax credit that's going to help cover some of the costs of their health care. And the government pays that subsidy directly to the health care provider of choice. So our company, and essentially yours, doesn't care which health care provider is chosen. We don't care if it's Blue Cross Blue Shield, Humana, Molina, Aetna, Coventry, Preferred Medical Plan, etc. Your clients can choose any plan they want. We're appointed with every single one of those providers in all of the states and territories. So that's good news. It's just a limitless pool for us to tap into. So I'm going to jump right into exactly who your target demographic is. Who qualifies? There's a few eligibility requirements. They need to be a U.S. citizen or not be a U.S. citizen. I know that seems a little tricky, but at the end of the day, it's pretty much everyone. If you are legally living in the United States, you qualify to get help paying for your health care. As long as they're lawfully documented. So as soon as, let's speak about immigrants specifically, they don't have to be citizens, but as soon as they come to our country legally and either apply for some sort of immigration status or citizenship, or at least have temporary residence through a student visa or a passport or a work permit, whatever, as long as they have an alien number and a social security number, we can get them covered. You can't be incarcerated, so we can't cover anybody who's in jail. That's illegal. And they cannot be eligible for Medicaid, Medicare, COBRA, TRICARE, or any other minimum requirement coverage. Okay, so if they already have Medicaid or they qualify for Medicaid, when we put them into the application, they're automatically going to get kicked out and picked up by Medicaid. This one's kind of strange, but it's just one of the quirks of the law. You can't qualify if you're married filing separately. You have to be married filing jointly or single head of household. And lastly, you got to fall between 100% and 400% of the federal poverty line in order to be eligible for the subsidy. If you're way above the federal poverty line, you can still gain access to regulated cost health care. You just won't receive a tax credit to help you pay for it. Here's a long list of the acceptable immigration documents for non-citizens. Okay, as long as you're a permanent resident, you have a green card, a reentry permit, travel document, employment authorization, all the way down to Office of Refugee Settlement. You can even just have a document indicating withholding of removal. So if they're actually waiting to be deported, they still can qualify, not just for the health care, but help paying for it. On this note, let me add one thing. If they have to be taxpayers, okay? So if they've never filed taxes before, that's fine. But they have to say that they believe they're going to file taxes next year in order to qualify for the subsidy. Again, even if they're not following, for 2014, they just have to be filing for 2015 and beyond. And they have 3 years to do so, by the way. You have up to 3 years to file your taxes. Okay, so let me get into some of the technicalities. These are the important terms that you're going to hear me say, but I'm sure you guys are all pretty familiar. The subsidy, that's the tax credit. The modified adjusted gross income, all you EROs know that that's a tax term. So the applicant's not going to understand that in filling out the application, it's not asking for their net or gross income, but their adjusted gross income and their modified adjusted gross income. That's going to be, their profit that they bring home if they're self-employed or independent contractors. And for everyone else, it's going to be the amount of money that they bring home after taxes and deductions are applied. The applicant's family size is going to determine, is one of the determining factors for the amount of subsidy that they get. For a person of 1, it's going to be a lot less than a family of 5. Your total household income needs to be accounted for, and where they fall at on the FPL is a federal poverty line. That's the marker used to determine the income for a household in comparison to the federal poverty line, and it starts at $11,670, okay? So everybody who makes at least, we round up, $12,000, that's the minimum requirement. That is going to get you the maximum subsidy, and for most people it's going to make their health insurance free. So while we're talking about your target demographic, we want to help our clients get up to that number. If they make less than that, they're going to get sent to Medicaid, but it's going to be a lot less coverage and a lot lower quality. So if we can help our clients account for maybe a little bit more income, it's beneficial to both of us, to us and the clients. Maybe they cut trees on the weekends, maybe they cut hair, maybe they babysit, maybe they have cash contributions from their family members, unemployment counts, Social Security counts. Any taxable amount of money would help to account for their income. And lastly is the benchmark. This one's kind of confusing and you really don't need to know it, but it's the second lowest price silver plan in your area because all the plans vary from low to high, bronze to platinum. Right in the middle of the road is silver, and that's the cost shared reduced plan. Okay, so anybody who gets a silver plan is going to get the most bang for their buck. So remember that, silver plan, silver plan. Okay, the way that the subsidies are calculated are based on your household's total modified adjusted gross income, the age of each applicant, the location that they live, and the second lowest price silver plan in their area. Okay, so where they fall on the federal poverty line also will determine the amount of their family contribution. So there's a max cap set for every family. For example, if your monthly income puts you at 133% of the federal poverty line, the most by law and definition that the government can require you to contribute towards health care is 3% of your total income. And I'll go into that a little bit more. So here's a nice chart for you guys to see. For a household of 1, the minimum requirement is $11,670, and as long as they make less than about $47,000, they'll qualify for a subsidy that will pay for their health insurance, or at least a portion of it. Some states extended Medicaid, and in those states, the minimum requirement would be about $16,000 for a family of one. But look all the way over to the right for a family of, say, 6. The minimum requirement is $32,000, which, A lot of people can fall between that 32,000 and 127, 128,000. So there's a pretty big window of opportunity there. Obviously, you know how to determine your family size. That one's not for you. And we've talked about the modified adjusted gross income. Here's a chart determining the caps on the premiums that have been set. So if your clients are anywhere between $12,000 and say $20,000, the most that they could be asked to pay is 4% of their total household income. Okay? This is important because a lot of your clients are going to say, well, I already have insurance. Well, how much are you paying for your insurance? Well, I'm a teacher. I get benefits. I make $30,000 a year, but they take $400 out of my paycheck for the month from me, my husband, and my son. Okay, so the total that she's paying for her insurance is more than 9.5% of her income, and that's by definition not affordable. She can cancel her policy and reapply through the marketplace for cost-shared reduced plans. Okay, and if you guys need any of these visuals, I can email them to you when we get off of this call so that you'll have them for your records. So again, remember that max cap for anybody, no matter what their income, is 9.5%. So regardless of how much money they make, regardless of where their money comes from, if they are contributing more than 9.5% of their total household annual income towards health care currently, they can cancel those policies without penalty, reapply through the marketplace, get cheaper insurance, probably better coverage, and you guys would get the commission or the referral fees for that applicant. The client's monthly premium is based on these factors: the benchmark that we already talked about, the second lowest price silver plan in their area, their household income, their household size, and the age of each member. Okay, so this is how the subsidy is calculated. They take that benchmark plan, and it's a different number for everybody. So they take that benchmark plan, okay, and that's the first factor. Then they take your annual income, multiply it by your max premium cap, and then divide it by the year. And that's how you get your subsidy. So then you choose the plan you want, apply the subsidy, and that will give them their total out-of-pocket expense. So for example, Henry, he's not married, he has no kids. He's making right about $12,000, which is the minimum requirement. So he is eligible for that tax credit. Okay, he's not eligible for Medicaid or any other coverage. He's 30 years old, and his benchmark plan is $273 a month. So he chooses a plan that's $219 a month. That's the cheapest silver plan in his area. We're going to take that $273 of his benchmark plan. Okay, then we're going to take his income of about $12,000, and at $12,000 or 100% of the federal poverty line, he has a 2% max cap. Only 2% of his income can be contributed towards health care. Well, that divided by the year, or 12 months, and then subtracted from his benchmark plan, makes his subsidy $253.57. But since he chose a plan that's $219, his total out-of-pocket cost is going to be zero. He's not going to get that extra money back. He's not going to get a return check for the difference, but he is going to get free health care. So that's exciting. There's a few more examples here for family 2, 3, and 4, but you guys get the idea. Let me jump right into the plan types, okay? And actually, if you guys will hold on one second, I just got a text message from Keaton Copeland, my CEO. He wants to join the call, so I'm going to forward him this number really quickly. Bear with me. Oops. All right. Okay. Back to the plan types. Okay, so the ACA has 4 types of health insurance plans, okay, and they're ranked from the most expensive out-of-pocket cost to the least expensive. It starts with catastrophic. This is only going to cover catastrophic events, okay. Then there's bronze, silver, gold, and platinum plans. Your bronze and silver plans are going to be for those of us who are pretty healthy and we just want to be able to go to the doctor to see a primary care physician for preventative methods or, you know, occasional checkups. Our gold and platinum plans are going to be for our clients with pre-existing conditions and extreme health conditions where they're going to need to see a doctor all the time. They're going to pay a little bit more monthly, even with the subsidy application, but in the long run they're going to save a lot of money in copays and deductibles and things like that. Again, that silver plan is basically what we're going to recommend for everyone, because traditionally the silver plan covers 70% of all of your health care expenses. However, if you qualify for the subsidy, you automatically qualify for cost-shared reduced plans, and that jumps up to 94%. That they're going to cover 94% of your health care costs, and you're only going to be required to be responsible for 6%, which is really exciting because, I mean, again, let me tell you guys something. I have a silver plan here in Miami. Preferred medical plan, which is only in Florida, is my provider. I pay $14 a month for my silver plan. I have $0 deductible, so they cover me right away. I have a $5 prescription program, so no matter what prescription I get, I pay $5 copay. I have a $5 primary care copay, so no matter what I'm going to the doctor for, I pay $5. $15 for specialists, so I pay $15 to go to the chiropractor, etc. I mean, I had surgery on my shoulder, and I had a $50 copay. It's crazy. Like, it really is the best coverage I've ever had and the least I've ever paid for it. Now, I qualified personally for the maximum subsidy because I don't claim very much income. I'm an independent contractor. My other income comes from self-employment. So after everything is considered, my profit or my modified adjusted gross income is about $1,000 a month. So I end up qualifying for the most coverage, and I pay almost nothing for it. Again, most of your clients are going to fall into that bracket, and you as EROs are going to be able to help them account for those qualifications because they are going to be able to write off so much of their expenses and such that, you know, the actual amount of money that they profit is going to be pretty low, and that's justifiable. There are household changes that will affect their eligibility throughout the year. If there's a birth in the family, an adoption or a death, divorce or legal separation, marriage, etc. These things directly affect the amount of money that we make and need to be reported throughout the year. So you as tax preparers need to let your clients know if you end up making a whole lot more money than we are putting on this application, you need to let me know so we can send that information to Express ACA, let them update your account so you won't be penalized later or asked to reconcile and repay a large amount of your tax credit. Which brings me into the next slide, reconciliation. Okay, this is important. If the advance payment exceeds the amount of the credit that the individual actually is eligible for, then a portion of that overpayment must be repaid. Now, the Affordable Care Act originally limited that amount to be like $250 for an individual and $400 for the family. But there was a provision that came in 2010, and now there's a sliding scale of repayment. Okay, and I'm going to show you guys that chart right now. Under the current law, it's based on your income level. So if I apply self and I say, yeah, I think I'm going to make $1,000 a month in profit for the next year, that would be my modified adjusted gross income that qualified me for the maximum subsidy, the maximum tax credit I'm getting for health insurance. But let's say I switch jobs or I get a big raise or I get married in the middle of the year and my income quadruples. When I go to file my taxes in the beginning of 2016, I'm going to be asked to reconcile. And since I qualified for a tax credit for someone that was at 100% of the federal poverty line, but by the end of the year, I ended up sitting at, let's say, 400% of the federal poverty line, as an individual, I would be asked to repay up to $1,500. Now, let's talk about this for a second, because that at first seems a little alarming, but let's look at it realistically. my health insurance would have cost me $270, maybe $300 a month. So instead of paying $3,600 for the year for my health insurance, I paid nothing for the year for my health insurance, and worst case scenario, I might have to pay $1,500 back on my taxes. And for many of your applicants, they'll have kids and child care credit and all kinds of stuff, so they get a return anyway. So they might get a little less money. Essentially, get free health insurance, pay a little more taxes later. And that's kind of the way it goes, is pay now or pay later. We have to have health insurance. Everyone is required by law to be covered. So with that being said, they have some choices. They can either pay for their own health insurance and then see what if they qualified for a tax credit when they go to file their taxes at the end of that year or the beginning of the following year. And then they'll get some money back on their taxes, and it will come with their regular tax return. Or they can accept the tax credit up front, pay nothing for or less for their health insurance, and then reconcile when they go to file their taxes. There are penalties if you do not get health insurance. If there are, you have tax clients that are saying, I don't want health insurance and I'm not going to pay it and nobody can tell me what to do, and screw President Obama, he can't make me have another bill I don't want to have, I'm healthy, I don't need to go to the doctor, I'm fine. Here's your answer for them. Well, they're going to end up paying for it regardless, because for anyone who fails to get that minimum requirement coverage for health care, they're going to be hit with a penalty when they go to file their taxes. And for most people, it's going to be the greater, or for everyone rather, it will be the greater of two specified amounts, okay? It's either going to be, so for 2014, it was about $100 for an adult and right about $50 for every child in the house under 18, for a maximum of $285 per family. Or if they 1% of their income is greater than that $285, then that's what they'll be required to pay. So you guys are going to be dealing with this right now because here we are in tax season. So your clients that come in, show them that. Listen, you have, here's what's going on. We're calculating your taxes, and you're going to have to be deducted $285 for your family, or whatever's greater if it's the 1% of their income. This is what you're paying because you didn't have health insurance in 2014. But in 2015, it jumps up to about $1,000 per family, or 2% of their total income over the tax filing threshold. Okay, that's $325 per adult, and about $163 per child under 18. That's crazy. They're just giving money away. Why not go ahead, get the health insurance, and either pay for it and receive the tax credit later, or receive the tax credit now. Don't worry about the bill. Let that pay for your insurance. If you never use it, fine. Get a catastrophic or a bronze plan that's going to cost them $0 and cover just preventative care, primary care visits, all of them cover maternity, etc. Okay, so for 2016, those numbers go up. So it's going to be about $700 per adult that they're going to be penalized for not having health insurance, and $350 for every kid under 18. That's crazy. They're going to just give away $2,000 for not carrying health insurance for their family. And God forbid some tragic, unforeseen, unfortunate event arises, and now they're faced with hospital bills and or the cost of treatment that they can't afford. They're going to end up paying for it anyway, whether they have to pay out of pocket or they end up in debt. It's all bad. So we want to encourage them, avoid these penalties, get covered, then you have health care you can use, and it's not Medicaid, and it's not crappy health care. It's excellent, top tier HMOs and PPOs. They can add vision, they can add dental, they're going to have low copays and full coverage health care. And it's actually better coverage because it's federally regulated than privatized or commercial plans. So the plan that I used to have with my old job, I was paying $142 a month, but I had like an $8,000 deductible, and I had $50 to $125 copays plus percentages of co-insurances. Anyway, the point is I was paying an arm and a leg, and I didn't really need it, and it wasn't really that great. And now I have this cost-shared reduced plan. It's giving me maximum coverage. I'm paying minimum out-of-pocket expenses, and I don't have anything to worry about. And I'm going to avoid these penalties on my taxes. So the long short of it is, now that we can bridge the gap between taxes and healthcare by assisting our clients in applying for this tax credit, we have a new niche. Guys, we have a new niche, okay? I've just gone over all the key components of the Affordable Care Act for you so that you have a little insight on what it is and you can articulate these things to your existing client base if they ask. But I'll be honest with you, most of them won't. They're going to say, oh, Obamacare or free health care? Yeah, sign me up, okay? This is a $200 billion pie. I'm getting my slice. I hope you guys get yours. You know, this little bit of education will help expand your knowledge. It's going to grow your business, and it's going to increase your revenue. That's the end of my slideshow. I'm going to turn my webcam on and open up the floor for questions. You guys let me know what I can answer for you. I also believe Keaton's on the call, and he has some information for you EROs about the 7216. So Keaton, if you want to chime in, now's a great time.
Shannon, I have a question.
Sure.
This is Jimmy Jackson in Houston. I'm sitting in for my wife.
Okay.
The eligibility requirements, it says even non-citizens, does that include individuals that are on a work visa, such as a religious visa or an H visa?
Absolutely, and I will send you that entire chart so you can see it, but yes, it does include them.
Wow, that's really good.
Hey, let me ask you guys a quick question. Maybe Nick or Rod, you can answer this for me. How does Keaton turn his audio on? Or can he?
Oh, okay, give me 1 second. On the left of his name inside your message bar, it should be orange. If you click on that microphone, it should turn him on.
Okay, let me see. I'm trying. Bear with me, Keaton. Does anybody else have a question?
This is a great slideshow. Is there any way you can share it with
Absolutely. I can send you the entire slideshow. I also have it recorded in a video format with me just giving you the same spiel I did, explaining everything in detail. I can send you that training video as well if you would like.
How do we
Oh, somebody's unmuted.
Oh, sorry, Ms. Jackson. Mr. Jackson, go ahead.
Was I muted?
No, I'm sorry. How do you request the slideshow so my wife can see it? Because this is fantastic.
Now, everybody.
You know what? I will get. I think I have all of your contact.
Okay.
I'm sorry. Go ahead.
Oh, no, Ms. Shannon's already sent us all the information for all our current customers, so we'll go ahead and get that information to you guys, as well as the PowerPoint presentation and everything that she sends us. We'll go ahead and pass that along to you in an email format. If anybody else has any other questions, at the top of your GoToMeeting, there's a green or actually maybe orange phone-looking dot. If you click on that, it'll unmute you and you can ask your question. And actually, I think we have a question in the chat from Ms. Wendy. Her question is, on the requirements, foreign passport, can you explain on how that would work if they do not have an SSN or alien number?
Sure. Unfortunately, if they don't have a social security number, there's nothing we can do. They have to wait until they receive their social, because most immigrants have applied for a social if they don't have one. That application receipt number would count if they had a social. But until they receive the social, it's not enough alone. It has to be the social security number and the alien number and or document type. So It can be a foreign passport with a visa stamp. It can be a student, a visa or a work permit, or and I will make sure you guys get that list. Any number of those things that you saw in the slideshow, but unfortunately they have to have a social. We haven't found a way around applying for people without a social yet.
Okay, thank you so much. We have one more question from Ms. Granada. She's asking, if you have coverage through your work, can you cancel if your income meets the FEL and get coverage through the marketplace?
Yeah, actually you can. That's where that max cap comes in. And that 9.5% is such an important number, because if a lot of people who are receiving health care through their jobs, obviously we know we're still paying for it. They're just automatically deducting it out of your checks for you. So you have to go to HR or just do the math yourself. But if that group policy cost or your personal or family policy premium exceeds your max cap of your family contribution, then it's not by definition affordable. And you can cancel. I'll tell you, we get people all the time that are like, listen, I'm paying $600 a month for my family insurance, or I'm paying $300 a month for myself. I only report $28,000 a year. Well, in that instance, it's not affordable. It's more than their max cap for their income, and they can cancel that policy. And I'll be honest with you, a lot of these providers are tricky. They're not disclosing that information, honestly. If I've had clients that say, I called Humana and I tried to cancel, and they told me I can't cancel for 90 days, or I had to submit X, Y, and Z in writing. It's not true. So I've had some people that had to make a little fuss about it, but for the most part, everyone else has had a pretty easy experience in that manner. Yeah, cancel the policy. I don't want it anymore at the end of the month, and they can apply it in the current time. So, for example, if they know I'm working right now, but I'm retiring, or I'm taking a leave of absence, or I'm quitting and changing jobs, and my new job won't have coverage in 3 months. So I'm only working here for the next 3 months. I do have coverage now, but I won't after that. They can apply with us now, and we can set their start date to become effective when that other policy is canceled. So if they already have existing coverage and they know it's too expensive and they want to cancel it, go ahead and apply with us. Just tell me, I already have this coverage, but I'm canceling now, and it'll be, as of the end of the month, I will no longer have coverage. So we'll set their next start date for the beginning of the following month.
Awesome. Thank you so much. Any other questions that anybody wants to ask, you can type them in the chat window below, or you can unmute yourself through the orange button that looks like a little phone at the top. We'll go ahead and stick around.
Okay, I do see that. Sorry. I do see that Tina Kearney, I hope I'm pronouncing your name right, had a question. It says, what if a family had insurance for over months, and then due to a job change, the only insurance and kids have insurance, but not the spouse? Would the spouse be penalized? Okay, so the way the penalties work is you have to be covered for the majority of the year. If you go more than 3 months of the calendar year without coverage, you'll be penalized. So in that instance, let's say there's a mom, a dad, and 2 kids. Because of their income, the kids have Medicaid or whatever that state exchange, help is. And the mom has coverage through her job, but the dad isn't working, and it was too expensive to add the dad to the mom's policy. He can apply for health insurance for just himself, but all household members would be listed on the application. It would just need to indicate that they don't need coverage. So like if me and my husband, I have insurance but he doesn't, we would both still be listed on the application, and it would say just that, like, I don't need coverage but he does, because it would take into account both of our income.
And I think she made an adjustment on that. She meant 6 months and 1 day, I believe.
Oh wait, let me see. 6 months and 1 day. Okay, let me read this again. Okay, so over 6 months and 1 day. No, it's I'm sorry, I'm not sure I understand your question. It's there's 3 months. You can go 3 months without coverage, but more than that, you know, they're going to be penalized. Like if you had to have insurance for the majority of the year. Yeah, the majority of the year is actually 9 months. They cannot go more than 3 months uncovered without being penalized.
Okay.
Yeah. Let me see. I think there's...
Miss Wendy, you can help a client signed up for ACA.
So, Wendy, that's a great question. And let me show you guys something. Give me just a second. I'll pull up the actual app for you to see. That's not it. See, I'm on a laptop that's not mine, so I have saved all of these things, but I'm having a little trouble finding them. Maybe it's this one. That's not it either. Okay, well, I'll send you guys the fillable PDF of the, oh wait, maybe this is it, of the Marketplace application. It's a 2-page app. I was explaining to Rod this morning that much of it is optional. So if they don't, okay, I've got it. If they don't sit down and fill out every single point, it's okay. What is most important is the contact information and the citizenship. So if they are citizens, we just need their social security number. And let me be frank with you. If they're not citizens and they want to apply, as long as they have a social, we're just going to say, yes, they are a citizen if we don't have their immigration document type and alien number. So if I receive an application, and I'm going to share my screen with you again. This down here. Okay, this is the app, okay? I need the name filled out first and last as it appears on their social security card. An email address where we can contact them, but a lot of our clients don't have email or access to email. Every single Marketplace account is associated with an email address, and there's no way around it. So if we receive an application with no email, we create one for them. Many of these applications, actually all of them, let me be honest, we're going to create an email address for them. And it's kind of a throwaway email. It's just for the purpose of creating the account and establishing a username. I need their date of birth, their sex, social, home and mailing address, hopefully it's the same, and a valid phone number. After that, they have to say yes, they're going to plan on filing a federal income tax return for the following year. And then A, B, and C of this section are semi-important. And let me elaborate a little bit. If I receive an application with only one person's name and none of the rest of the questions are filled out, I'm going to assume that they're single head of household, and that's how they file. If they do not file single head of household and they want to include their spouse on the application, whether that person needs insurance or not, then they can just indicate, yes, I'm filing jointly with the spouse. But if they say yes, they have to list the spouse's name, date of birth, and social. If they're claiming dependents, I need the same information. Name, date of birth, and social of each of those dependents. And the reason that someone would include the dependents even if they don't need insurance is because that would help reduce their cost or raise their subsidy, because technically they have a higher financial responsibility. So, you know, a family of 3 for a person who only makes $50,000 is going to receive more of a subsidy than someone who's filing as an individual who makes $50,000, because then they're not going to qualify for the subsidy. And then from this point forward, none of this really matters. This is an optional question about their physical, mental health, about pre-existing conditions. It just doesn't matter. We honestly don't even answer it on the application. Again, if they're a citizen, I'm going to need the document type and the alien number. All the rest of these questions are optional. If you need help paying for the medical bills for the last 3 months, they can say yes or no. It doesn't affect their eligibility. Live with children under 19, they can say yes or no. It might affect the amount of subsidy they get, but they have to, again, include that child's full name, social security, and date of birth. If they're a full-time student or we're ever in foster care, again, these are optional questions. Race and ethnicity, optional questions. We leave those blank on the actual application. On the last page, or the second page rather, is the fillable space for the additional household members. So if there's a spouse, you can list the name here, date of birth, social security number, home address. If it's not listed, we'll assume it's the same as the main primary applicant, etc. Again, if I don't have anything that indicates that they're not an eligible citizen or that they're not a citizen with eligible immigration status, I'm going to assume they are a citizen. Now let me clarify for this part. If they are not a citizen, but let's say they leave that part blank, or they didn't provide the immigration or alien document numbers, then we're going to say then they are a citizen, and yes, they do need health coverage. And then we're going to say then we're going to submit the application that way. When the marketplace receives the application and processes it, if for some reason a red flag comes up about their citizenship from public information, and they have reason to believe maybe they're not a citizen, there's no penalty or even delay in the application. They're just going to send out a letter to that person's home saying, please verify your citizenship. If they are a citizen, then they can, just show those documents or scan them in, upload them to the website, or send them to us and we'll do it. Or they can, do the same thing with their immigration documents. Here's my green card or my temporary resident card or my student visa. Here's my alien number. They'll just want proof. That's it. They're not going to lose coverage. It's not going to change their subsidy amount. But if we can't verify the information, we still push them through. Okay? And then they might have to verify that later, either with the marketplace or their provider directly. The rest of this application is just space for additional household members. Again, it almost doesn't matter. As long as the people who need health insurance are listed on the app with their names, social security numbers, dates of birth, one home and or mailing address, and one phone number, then we can process the app and get them approved. Any questions?
Awesome. Thank you so much. Did we just answer Ms. Crystal Martinez's question on how long does it take to get any information on coverage?
It's going to vary depending on the applicant and our ability to get their identity verified. The marketplace uses Experian Credit Bureau to verify identity based off of public record. It has nothing to do with your credit score or history, just that there is public record of a credit history in this country. So for our immigrants or people who have not lived in this country for very long, or for anyone who's like 18, 19, or has never applied for any form or line of credit, they're not going to be able to verify their identity based off of the source they're using. So we have to either manually verify by submitting documents, or we have a little secret sauce in helping do so. So basically, it depends on the insurance company.
Okay, awesome.
I will say, when we receive the applications, as long as they're completed with that name, date of birth, social security number, and address, then we process them in real time. So as soon as we receive it, you can bet it's getting processed. The turnaround time from the point of submitting the application and getting the application processed to the that applicant actually getting verified and hearing back can be as long as 2 weeks. But we try, a lot of people, we can process the app same day, get them approved same day, send out the confirmation within 24 hours. But again, some of those insurance companies can take up to 2 weeks, so it just depends.
Okay. Anybody else have any questions? You can type them in the chat window there at the middle of the GoToMeeting, or you can unmute yourself at the top. We'll give it about, I'd say another 5 minutes, and then we'll go ahead and end it off. Any other
Awesome.
questions, anything like that, please feel free to chime in.
Shannon, this is Beverly Collins, and I'm wondering, how do we get the applications for our clients?
Thanks for asking, Beverly. That's a great question. We are going to give you guys this PDF, the fillable PDF. You can either type in the answers and email it back to us, or you can print them off, have your clients fill them out physically, and scan or take a picture of those applications and email them back to us at info@expressaca.com.
Okay, so you will be sending it out to us, right?
Yes, ma'am, absolutely.
Okay, how soon?
Today. As soon as we get off this call, I will make sure that your entire contact list has that fillable PDF along with the consent form.
Okay.
All of the charts and quick points of reference that I talked about today, I have a short, quick reference manual to send to you for your records. That way, if you have clients with questions, you can, have access to those answers pretty quickly.
Okay.
I'm also going to send you the logo, just in case you want to stick it on a flyer or an email.
Yes, I do. Yes. Well, can we do
Okay,
this?
and
I
also-
should do this all year round, right? Can I
That's
do
another
this
good
all
question.
year round?
Yes and no. So let me explain. Okay, open enrollment is scheduled to end February 15th. So we really have about a month to just flood the gates.
Okay.
However, last year it was extended to April 15th. Even though it was scheduled for February 15th, they pushed it back. March 1st, March 15th, April 1st, April 15th. So we ended up having an additional 2 months to get these apps in.
Okay.
After that, there's this awesome thing called special enrollment period. So for the remainder of the year, anybody who didn't get insurance because they tried to apply through the marketplace but experienced glitches, which is live and real and happens. Me too. Okay.
I had a lot of glitches, so I just stopped it. But I need to get something in today.
Well, you can send me those apps today. We'll give you confirmations and responses to each one of those applicants ASAP. But for special enrollment period, the rest of the year, anybody who experienced problems with the websites, anybody who lost a job or etc., they'll still be able to apply for the remainder of the year. The problem with betting on special enrollment is this. We can't guarantee the same referral fees for the remainder of the year because the health insurance companies all are scheduled to stop paying out referrals by the end of open enrollment.
Okay. All right.
So there's a chance we'll still be able to make money beyond that. We'll definitely be able to help our clients that got married or divorced or lost a job or lost coverage, reduce their hours, or experience glitches on the website. We'll still be able to help them. But I'm not clear on what our referral fees will be after open enrollment. So don't bet on it.
Okay. Well, how much are the referral fees before it closes out, Shannon?
That's a great question, and I am going to share another document with you.
Okay.
Briefly, that's such a good question. I can't believe I forgot to address it sooner. Our referral fees go from $25 per applicant to $150 per applicant, depending on the volume that get qualified. Okay.
Okay.
So to be clear, we don't pay out for just the application. The applicant has to actually be enrolled in a plan and pay their premium for 3 months.
Okay.
So as long as they're enrolled, let's say by today, okay, we'll get them in by February 1st, we'll say. So they're enrolled February, March, and April. At the end of April, we will know, okay, clearance to pay out referrals for all the list that was submitted, by January 15th or January 31st or whatever.
Okay.
And those payout dates are scheduled. Let me clarify with Keaton briefly. But I think he said April 15th and June 15th. April 1st and June 1st.
Okay. Okay, that's fine.
April 1st and June 1st. And I know, Rod, I think I told you something different yesterday. But I clarified, and those are going to be the 2 scheduled payout dates. By June 1st, we'll know, everybody who got in during open enrollment, they will have been cleared for 3 months, and those checks will be cut immediately.
Right. Okay. I thank you, Shannon.
No, you're welcome. I'm still looking for the scale
We
for you.
appreciate you.
Shannon, I have an issue or something that I need to. You said if they're not citizens, you can still put down that they're citizens?
Yeah. If they're not citizens and they don't have, let's say, because, okay, let me be specific. We
Well,
get applicants. Go ahead, I'm sorry.
I have an issue there because if someone that's a non-citizen claiming to be a U.S. citizen in any application, you can affect their immigration status, and they can get in serious trouble because that's a felony, and this is an application for a federal benefit. So I think this is something that needs to be addressed.
Absolutely. So let me clarify. The time of the application and the consent form explains that, or the consent for the marketplace questionnaire explains that we are submitting information to the best of our knowledge. So if I don't have knowledge or proof or forms that say that someone is not a citizen, it is assumed that they are, and they will be given the opportunity to clarify afterwards. And it's not with the actual, because it doesn't affect their tax credit, which is the federal part of it. It only affects the records part, which is specifically to do with the healthcare providers. So again, they will be able to, submit or clarify their citizenship with Humana directly, with Blue Cross Blue Shield, and all that they would have to do is submit the documents. There's been zero penalizing, for any discrepancy on the application in regards to citizenship. And another thing we've experienced is that it's strange, but there seems to be no consistency in submitting the application, citizens versus non-citizens. And what I mean by that is, we have people who are citizens that have to verify their citizenship, and people who are not citizens who have to verify their citizenship, regardless of how they applied, whether it was accurately or that was left blank. Does that make sense? I mean, it's kind of random selection, is my point.
I don't know, I still think it's an issue, but because the person themselves can get in trouble.
Well, there's privacy acts tied to this. They cannot be deported for applying for health insurance, and they cannot be penalized for applying through the marketplace. It has absolutely nothing to do with their immigration status.
Okay.
But to your point, I will say this. The most accurate information and the most amount of information that you can get on the application from your client, the more, the better off they are, because the more quickly and accurately we can get them covered without, hopefully encountering, any need to verify later. But again, like I opened, there seems to be a random selection when it comes to verifying immigration status and citizenship. So, they may or may not have to verify anyway.
Okay.
Okay, so the pay scale, I can't find the page that I was going to show you, but let me just tell you about it. So for the first 100 people that you sign up, 0 to 100, you're going to receive $25 per qualified applicant. Okay? Over 100, from 100 to 1,000, okay? So for the first 100, you're going to get $25 per app. But for the next 900, you get $50 per app. From 1,000 to 10,000. And I will email you guys this document so you can look at it and save it for your records. But from 1,000 to 10,000, you're getting $75 per app. And anything over 10,000 jumps up, I believe, to $125 per app. But I'm still looking to make sure that I'm giving you the right number on that last scale. I just don't see it.
While you look for that, we had another question that would be, would a person qualify if they had a felony?
Okay. I just, let me backtrack, I'll answer your question. I just got this. Okay, so 0 to 10, and I'm sorry for misinforming you, let me clarify. So for the first 10 apps is 25, okay? 11 to 100 is 50. 100 to 1,000 is 75. And 1,000 to 10,000 is 100. Anything over 10,000 is 150 per app. So clearly, it's a numbers game. It's about volume. And to your last question about the felony, yeah, absolutely, they still qualify. Their legal history has nothing to do with the application.
Okay. And then another question after that we had was on the non-citizen question asked, does that mean the client only that have permission to be a U.S. can apply?
Yeah, if they are undocumented or unlawfully here, there's just they don't qualify.
Okay. And then the last question I see is, so the person who have an ITIN number, they don't have to get insurance. And I think that's, you may have already covered that.
Let me ask Keaton just to be clear. I'm not sure about the I-10. In my understanding, I think they have to have a social, and the I-10 doesn't qualify, but let me find out. Oh, yeah, it works. I-10 does work.
I-10 do work. Okay, awesome. Thank you so much, Andy, Andy's office, for your question.
As long as they're legally here, and I mean, and it can, again, I'm about to show you this screen again, so you can look at this while we're talking about it. But yeah, there's a number of documents that will qualify them as long as they're legally documented. They cannot be illegal.
Okay.
It cannot be illegal.
All right. Anybody have any other questions they would like to ask? So you can type them in the chat window or unmute yourself and ask the question out loud.
And okay, let me check these chat questions.
I think we may have answered all of those now.
Yay.
Well, thank you everyone so much for joining us, and Ms. Shannon, thank you so much for your time. As we said, everyone will receive an email. All of our current customers will receive an email that has all the information in it. If anybody who isn't signed up this year, go ahead and get with your sales rep so we can get that information sent to you as well. Once again, Ms. Brown, thank you so much for your time.
You're welcome.
We'll go ahead and close it off here. If anybody has any questions, just be sure to keep an eye on your email as well as call us here at STS and talk to your sales rep, 281-823-9300. Thank you so much. You'll have a great day, everyone.
Thanks, guys.